So tonight, it's so exciting to welcome an old friend. Ray Lutz has run for the Assembly, for the state, for the U.S. Congress. He started the Citizens Oversight Project some years ago. He got the Brown Act exposed there. He got arrested for registering people during the Occupy San Diego. He's sneaking up on me right now, isn't he? Okay. Then he took on the San Onofre. I'm sure all of you know that his involvement with that. And the first time I met him, he had gone to an East County Democratic Club meeting, and they said, we're gonna dissolve. And he's like, no, you're not. So he resuscitated the club, and like 2 years later, they won Club of the Year, as our club has. And then, of course, now he's with the March Against Monsanto, is been the person to bring Mr. Druker here tonight. He's awesome, and as his old campaign slogan used to say, don't be nuts, give it up for Ray Lutz.
Thank you very much, and really appreciate being able to work with the La Mesa Foothills Democratic Club to host a meeting like this, because we really lucked out. I was at the March Against Monsanto march earlier this year. We had 1,500 people marching, and at that march we said, well, what else can we do? Turns out this book was written earlier this year, and so I said, this is fantastic. I checked it out and discovered that this was not the regular corporate message, but a guy who's really telling the truth. So we got Mr. Druker here, and so that's what we're really proud of. Now, Citizens Oversight is a 501c3 nonprofit and nonpartisan organization. We can't endorse the Foothills Democratic Club, but you can endorse us. So we thank you very much for your endorsement. And what we are doing mainly is trying to get people involved in direct action with their local government, as in going to meetings, sending in emails and requesting information, this type of thing. Has been very productive. Well, I'm not going to get into that tonight. I'm just going to very quickly introduce the introducer to Stephen Druker. We are fortunate that this guy is in town. David Schubert Dr. David Schubert works at Salk, is a molecular biologist. He's head of the Cellular Neurobiology Salk Institute for Biological Sciences. So, David, come on up. Let's hear what you have to say to introduce Stephen Druker, and let's get this off.
Well, good evening. I promised that I'd make this short, and I've known Steve for some time. And I just wanted to sort of give you a brief introduction of where his sort of history from what I know about it. I missed him today because his plane was a little bit late, but I think I know enough to sort of make something of an introduction. So Steve is a public interest lawyer. He's a sort of a native son. He's got his degree from Berkeley, and I believe his law degree from Berkeley also. And he founded the Alliance for Biointegrity, which is a public interest organization. And through this organization, he was able to secure documents from the FDA concerning the development of the regulations for genetically modified food. And I believe this is the main, after reading this, I believe this is the main impetus for writing the book that he's going to talk about tonight. And so Steve served in a number of different capacities on various food safety panels and like the National Research Council, and I believe also the FDA, and testified there. He's lectured throughout the world, and I think he's fairly sought after by governments who are considering whether to ban genetically modified food in their countries and various states and counties. And he's also a consultant for these different government organizations. He's written extensively, a lot of publications and sort of in different journals. And the new book that came out, I believe in March or May, is entitled Altered Genes and Twisted Truth. I had the pleasure of being one of the several scientific editors of that journal, or that book, and in the introduction, I believe he's been traveling around with Jane Goodall for some time in Europe and some parts of the United States, and she wrote that this was one of the most important books of the last 50 years, if not the most important book, and I agree it's an incredibly important book, and it's something everybody should read, and I think it's very easy to read, even though it has a lot of science. It's not hardcore science, and I think Steve did a great job in translating the science into lay language. And so with that, I'm introducing Steve.
Thank you. Thank you, Dave. Thank you, Ray, and thank all of you for being here. It's always a pleasure to come back to California, and some of my happiest years were spent at Berkeley as an undergrad and a law student. Oh, good, thank you. Let's begin by just giving a bit of free rein to our imaginations. And let's suppose that some scientists at some point develop a radical technology through which novel forms of food could be produced. And suppose that although this method was highly unnatural, its proponents were able to convince most people that it was essentially the same thing as producing foods through traditional natural means. And let's further suppose that the very first ingestible product that this technology churned out, let's say it's a food supplement, that very first product causes a major epidemic that kills dozens of people, seriously sickens thousands of others, many of whom remain invalids for the rest of their lives. And let's postulate an additional fact. Let's suppose that researchers discover that that product contained a highly unusual mix of contaminants, at least one of which is deadly at extremely low concentrations, so low that most chemicals present at such a level would be completely harmless. And let's further imagine that the evidence as a whole strongly points to the new technology as the cause of that lethal contamination. Moreover, let's suppose that the very first whole food that technology turns out causes a troubling pattern of stomach lesions in the laboratory rats that are consigned to dine upon it. And that in another group of such unfortunate rodents, 7 deaths occur within the first 2 weeks, while only 1 death befalls each of the 3 comparative control groups that were spared consuming that novel product. And to further foul the picture, let's assume that the government scientists who review the test results conclude that they raise a safety issue that has not been satisfactorily resolved. And to make things even dicier, let's suppose that another division of government experts who review a completely separate aspect of that product declare that that separate feature in itself poses a serious health hazard. Well, now that we're warmed up, let's assume that a task force of government scientists thoroughly assesses this technology and concludes that it significantly differs from conventional modes of food production, that its products entail higher risks, and that each therefore needs to be subjected to rigorous safety testing before it is allowed on the market. Additionally, let's assume that several eminent scientific organizations issue similar assessments, and that the editors of one of the world's top medical journals declare that there are good reasons to believe that this technology poses health risks when used to create new foods. Well, furthermore, why don't we make things even more ominous by imagining that the very first food produced by this technology that is subjected to truly rigorous testing by independent experts who are free of industry influence yields very troubling results, and that because the study is of high quality, it gets published in a prestigious scientific journal. And now that we're becoming bolder, let's suppose that many other well-conducted studies on the foods created by this technology detect significant adverse effects on the lab animals who are unfortunate enough to eat it and eat foods that it produces. And that one long-term study finds serious injury to the livers and kidneys, abnormal onset of large tumors, and increased rate of mortality. Let's further envision that when independent scientists scrutinize the research that has been performed by the corporations producing the foods, they in several cases find that the data that was declared to support findings of safety actually raise serious doubts. And to make the plot even more sinister, let's suppose that in virtually every case of adverse results, there is good reason to think that the results have resulted from some aspect of the new technology itself, and that similar deleterious disruptions could have been occurring in other foods produced by it, but haven't been detected. So if such a technology actually did exist, and if all these suppositions we've just made about it were concrete realities, how do you think society should deal with it? I assume that just about everybody would agree that the foods it creates should be banned, and that the enterprise that creates them should be curtailed. And I doubt that anyone would consider that to be an extreme or unreasonable course of action. In fact, I think that most people would suppose that in such circumstances, that particular policy would be fully justified and should be decisively enacted. And just to be clear, the policy that would seem appropriate and necessary in almost everyone's eyes would not be merely to stick a label on these products, but to ban them. Well, as surprising as it may seem to many people, especially to those people who have been trusting what our government and the scientific establishment has been telling them, such a technology does in fact exist. And every one of the suppositions I've just set forth is not a mere supposition, but a rock-solid reality. Of course, the technology is recombinant DNA technology, which is more commonly referred to as genetic engineering, and euphemistically referred to by its proponents as genetic modification, which then allows them to say, well, we've been genetically modifying foods for centuries and centuries. I mean, when beer was produced, that was biotechnology, and when the first agriculturalists began tending crops and domesticating crops so that they had desirable traits and some of the undesirable traits of the wild varieties were basically selected out, that was genetic modification. And to try to pass off what has been happening in agriculture since time immemorial as somehow the same kind of genetic modification that occurs in the labs, it's complete blarney. And it's really gross. I mean, it is really outrageous that scientists who are well-credentialed and would abuse their authority to make such statements, but they do that. And again, every hypothetical situation that I laid out initially has actually happened. They are concrete incidents that are unshakably linked with genetic engineering. So let's go back and review. Let's actually look again at these situations that I laid out, now knowing that they actually did happen, that they're inextricably linked with genetic engineering. Okay, again, a novel technology, quite radical, very different than anything that human beings have been able to do prior to its development, then is passed off as something that's essentially natural. And in fact, some of the scientists, proponents of genetic engineering would have you believe, they make the claims, and these claims have been published and reprinted, that there's a seamless continuum between just simple, natural, just selective breeding, selecting out the best plants and replanting those, a seamless continuum between that age-old technique and modern genetic engineering, that every step in the way, if you put them all together, it's a seamless continuum. Well, contrast that with the statement made by a Nobel laureate biologist, George Wald, who spent his career as a Harvard professor, who stated that genetic engineering represents, and this is a quote now, the biggest break in nature that has occurred in human history. Okay, biggest break in nature. That's kind of a far cry from a seamless continuum. And then Professor Wald went on to warn, such interventions must not be confused with previous intrusions upon the natural order of living organisms. Okay? Shouldn't be confused with anything that had come before it. And an eminent molecular biologist, Dr. Lieb Cavalieri, who was one of the plaintiffs in the lawsuit that I organized against the FDA, more about that lawsuit later, but an eminent biologist. He spent many years with Sloan Kettering Research Institute, then at the time of our lawsuit was a professor at State University of New York. He stated that those scientists who are proclaiming that genetic engineering is essentially the same thing as traditional breeding ought to be ashamed of themselves, and they're perpetrating a major sham. Unfortunately, to my knowledge, there's not much shame that is circulating among the proponents of genetically engineered foods. In fact, if you hear them speak and you read what they write, far from shame, there's quite a bit of smugness and arrogance. Okay. What about that supposition, which actually is a concrete reality, that the very first ingestible product of genetic engineering, which was a food supplement, caused a major epidemic in the United States, and that was in the United States. That supplement was a supplement of the essential amino acid Ltryptophan. It's an essential amino acid. Not only is it safe, we all need it. And we all need to get it from our food because it's one of the 8 amino acids that our physiologies cannot synthesize on their own. Now, people for many years have been taking supplements of Ltryptophan because it is a precursor to serotonin. It has several other good functions. It actually was a healthful, cheap alternative to prescription sedatives such as Prozac, and it was helping people fall asleep who were having trouble fall asleep. It was being used by millions of people worldwide. There had never been a known health incident with those supplements. Then, in 1989, there was a major epidemic that swept the United States, and it it took quite a while to figure out what was going on. It was a novel new disease. It hadn't the combination of symptoms hadn't been seen before. It was finally linked to Ltryptophan supplement, and when traceback was done, every supplement that was linked with an outbreak, with a case, could be traced back to one manufacturer. There were about 6 major manufacturers of Ltryptophan in Japan, and only the product of only one of them was linked with that new disease. And guess what? It had begun using genetically engineered bacteria to speed up the process by which Ltryptophan was cranked out so they could make more money. And that was the only manufacturer that used genetic engineering. And when one actually looks at the evidence as a whole, which is very difficult because there's been a systematic effort ever since the link between genetic engineering and that epidemic was discovered, there's been a systematic effort on the part of the scientific establishment and our own Food and Drug Administration and even the Center for Disease Controls to throw people off the scent, to shift the focus away from genetic engineering, to give people the idea that genetic engineering had nothing to do with that accident, with that epidemic at all. In fact, the chapter in my book that discusses this is titled Disappearing a Disaster, because so adept has the disinformation campaign been that most people don't even know there was an epidemic. Now, many of you probably do, but I'm just curious. Up until just a few minutes ago, how many of you knew that there was a major epidemic in the United States that was linked to a genetically engineered food supplement? How many already knew that? Okay, it's a minority, and you're a very intelligent group. I've often talked with public health professionals. When I say, well, no, they'd say, well, no genetic engineered product of genetic engineering has ever been linked with a human health problem. I say, no, au contraire, there was an epidemic. They can't believe it. How come I didn't know about it? I have a master's of public health. I've been spending my life in public health. How come I didn't know about it? And I said, because people did not want you to know about it. And that's how good it's been. And for those people who do know that there was some concern about genetic engineering, then there are other layers of deception to convince those people that it's been absolved. And most people have been completely confused about it one way or another. But when one actually does the investigation, puts all the evidence together, the evidence strongly points toward the genetic engineering as the cause of that unusual toxic contamination. And in fact, in my book, I had the privilege of reporting on new data that had been gathered by researchers at the Mayo Clinic who had been researching this more thoroughly, really, than any other lab in the world. And one of the lead researchers in communicating with me liked the way I was doing the book, and he basically said, you know, you can have permission to be the first to report on our research. So that's in that chapter. When you put that research along with all of the other data, it's a very powerful case against genetic engineering. Not conclusively proven, but very strong. And in a court of law, if that were the issue, then there'd be more than enough for a jury to hold genetic engineering liable, far more likely than not than that it was the cause of that unusual toxic contamination. Okay, so that was and again, that's important to note. That product was the first to any of our knowledge, the first ingestible product of genetic engineering. Since then, there have been other food supplements. None of them has gone through safety testing, adequate safety testing either. They are presumed to be safe. If that particular supplement had not caused a unique disease, but it just increased the rate of colitis or the cancer rate by 30 or 40%, we still wouldn't know that it was harmful. We would not know. So just as if that drug thalidomide that had been taken by pregnant women to alleviate morning sickness had not caused unique birth defects, we still wouldn't, but something again more common, maybe cleft palate, that kind of birth defect, which is quite common. We wouldn't know that thalidomide was dangerous. It would still be in the market creating problems. We just wouldn't know about it. That shows the need for precaution, and that really shows the wisdom of our own food safety laws in the United States, which since 1958 had presumed that new additives to food are unsafe until demonstrated safe. We'll get back to the law, though, later, because you wonder, well, if that's the law, why is our market permeated with GMOs? Well, stay tuned. So let's now fast forward several years, actually not that many, that was 89, 90. In 94, the first genetically engineered whole food came to market. It was a tomato produced in California called the Flavor Saver. Many of you probably remember that name. Well, in a few years prior to its marketing, that manufacturer did more than the FDA was asking it to do, requiring any manufacturer to do. It actually conducted some safety tests. They were short-term, but they were more than most manufacturers are doing. They were tests using the whole food, feeding studies, and then with toxicological examination. That was much more than most genetically engineered foods in the pipeline were getting in terms of safety testing, or would get for many, many years. So that the manufacturer submitted the data from those short-term tests to the FDA scientists, and when they reviewed it, they discovered that there was a troubling pattern of stomach lesions, which in human population, similar lesions would be a threat to elderly patients or to any people who were taking aspirin regularly. And of course, that could have portended other problems as well. So the pathology branch studied it carefully, and they concluded that there was a safety issue that had not been satisfactorily answered, that more research was needed. Other experts from other offices reviewed the data and concurred. So you have the pathology branch through memos from the chief of the pathology branch and a few of its major scientists speaking on behalf of the pathology branch, the experts in examining such problems. That was their conclusion. More research is needed. An unresolved safety issue is raised by the data. The FDA administrators who received those memos did not like them, because the FDA, along with the USDA and the EPA, ever since 1986, under the Ronald Reagan administration, had been operating under a directive to promote the U.S. biotechnology industry, to ease the introduction of its products onto our market, and also to help reduce international barriers to their marketing worldwide. And the FDA has actually admitted that it does have an agenda to promote biotechnology. It just claims that it can promote biotechnology and at the same time responsibly regulate its products. That is baloney. You know, something's got to give. That's a huge conflict of interest. And what has become clear over the years is the FDA has done a crackerjack job of promoting biotechnology, and it has abjectly failed to regulate. In fact, it's not regulating the products at all. It's admitted that. There is not one iota of regulation being exerted on the biotechnology industry by the FDA. It puts up a big show in public, and so people think that it is, and that was part of a basic deception that the FDA has worked, to give the illusion that it's regulating them, to give the illusion that it's actually conducting scientific reviews, when in fact it's not requiring even that a manufacturer give a pre-market notification that it's going to dump a GMO on our market. They don't even have to tell the FDA, according to the FDA. And what the FDA is doing is allowing manufacturers to go through a voluntary consultation process, which is merely a horse and pony show to give the illusion that there is some kind of scientific review, when the FDA has actually also admitted at times that it's not a scientific review. It couldn't be. It doesn't even see the original data. So it's basically a rubber stamp to give the illusion that the FDA is on the job and doing something, when it's actually just rolled over and given free rein to the industry. That's a violation of the law. I'll get back to that, because here I should stay focused on the flavor saver right now. So what did the FDA do? The FDA administrators, okay? Their experts say this data raises a safety issue. The only way to resolve it is by more testing. So you should ask the manufacturer to perform more tests. Well, by then the FDA decided it did not want to require any tests from any manufacturers, because there could be troubling data. This was proof that the FDA didn't want to require testing. So it basically let the manufacturer know. Basically, it didn't ask for more testing. The manufacturer by then knew the FDA wasn't going to require testing of it or any other manufacturer of genetically engineered food, so it stood pat. Why do more testing if it might show more problems? What did the FDA do? It announced publicly that its scientists had reviewed the tomato. They were satisfied that every safety issue had been answered, that this food had been concluded by its scientists to be safe, and therefore it could be marketed. Pretty good trick, huh? You know? And now I mentioned that there was an independent issue, safety issue with that tomato too, completely independent of the stomach lesion issue. Because this didn't involve feeding studies of the whole food. It involved one of the genetic elements that was implanted within that food. I can't go into all the biology right now, but suffice it to say, when one takes a gene from a foreign species and forcibly implants it within the DNA of a species in which it's never been before, that gene is not going to express. The expression of genes is a very delicate biochemical dance, and genes only express when they're needed, to the extent that they're needed, and genes, the default position for almost every gene in our body or in a plant is to be inactive most of the time. Otherwise, there'd be a tremendous waste of energy, and also would be life couldn't be sustained. Proteins were being developed in places they shouldn't be and in quantities that shouldn't be there. So it's a very finely tuned dance. We don't understand all the rules, but we do know that the elements that precede a gene that pick up biochemical cues that basically let the gene turn on and express when it's needed and shut down when it's not needed have to be removed if you're putting in a foreign gene, because they're not going to pick up biochemical cues. And what is put in instead, in most cases, is a big booster from a virus that can infect a wide range of plants and get its genes forcibly expressed, and so those foreign genes are being driven by a viral booster. Now actually, and I really didn't need to bring that up, but now you know about it, because what I wanted to talk about was the fact that there's another element of the cassette, of the construct, the genetic construct that gets inserted in most of the crops, and that's a marker gene. And that's needed because most of the cells that are transformed or attempted to be transformed through genetic engineering get either killed by it or do not successfully take up the foreign gene. Only a very small percentage of the genes in any sample actually successfully take up the foreign gene or whatever the gene construct is. So there has to be some way to mark the very few successful cells and to separate them from the ones that didn't, from the background noise, basically. So what the biotech industry came up with, the idea was, let's put in a gene that confers resistance to an antibiotic. And then, once we've done the manipulation, we just douse the sample of cells with the antibiotic, and every cell that was not successfully engineered and doesn't have that antibiotic gene within it will get killed. And the only cells that survive, we will know, are the ones that took up that construct because they display antibiotic resistance. Now, the FDA, of course, did feel, as any, obviously I think you can think, the fact that there's going to be a gene conferring every cell within these new plants would be expressing a gene that confers resistance to an antibiotic, and in this case it was an antibiotic that actually had important medical uses, that might raise a red flag. Because, as you know, antibiotic resistance has become a major problem. Antibiotics are overused both in human health field and in agriculture already, being fed to livestock as a matter of course. So the FDA's Division of Anti-Infective Drugs wanted to review that issue. So they reviewed it, and they thought it was an extremely bad idea. Extremely bad idea. In fact, in the main memo that Division of Anti-Infective Drugs sent to the FDA's biotechnology coordinator, it's a very juicy quote, so I want to make sure to share it with you. Here's their main conclusion. They put it in all capitals because by then it had become clear that the FDA administrators were ignoring warnings from their own scientists about risks of genetically engineered organisms. So to try to break through that prejudice against adverse information coming from their scientists, they put this sentence in all capitals in the memo. It would be a serious health hazard to introduce a gene that codes for antibiotic resistance into the normal flora of the general population, unquote. What did the FDA administrators do? Well, they ignored that too, but they also lied about it. They stated in public that their experts had actually reviewed that marker gene and found that, concluded it was safe and it could be used not only in the flavor saver tomato, but in all forthcoming genetically engineered crops in which manufacturers would want to use it too. Just to let you know the extent of the irresponsibility, in another memo, when it became clear what the FDA administrators were doing, how they were overriding the opinion of the experts, one of the experts in the anti-infective drugs, or it might have been actually one of the other divisions too, because there were other divisions that also concurred, wrote a very strong memo pointing out that there were other alternative markers, that the reason the industry wanted to use the antibiotic-resistant marker was because it was easier for them, it was more economical for them, but that there were other alternatives. It's just it would have been more difficult, it would have cost a bit more. So what did the FDA do? Did it side with public health? No. It gave the industry the easiest route, even though it was the riskiest route. And that's our Food and Drug Administration at work when it comes to policing genetically engineered foods. So now to get back to the next atrocity. What about, I mentioned assuming that a task force of government scientists would thoroughly assess the technology and conclude that it's very different, it has risks. Well, that happened at the FDA. That happened actually before, that began before the review of the flavor saver tomato. And the FDA back in 1991 had formed a biotechnology task force. Those experts from various key branches of the FDA reviewed the best data that was known at that point about genetic engineering, about the risks, and they concluded genetic engineering is different than traditional breeding. It entails a different set of risks, and their memos detailed many different ways in which the foods could become harbor an unusual toxicant or become allergenic in some unusual way, or in some other way have an anti-nutritive substance. And these were risks that just did not exist in the average case of conventionally bred crops. So they pointed this out, and so pervasive was the concern that an FDA expert, a compliance officer whose job it was to monitor the input from the scientists and make sure the FDA was staying in compliance, wrote a strong memo to the FDA's biotechnology coordinator, basically protesting that the industry, that the FDA was trying to fit a square peg in a round hole by trying to force an ultimate conclusion that that there is no difference between foods modified by genetic engineering and foods modified by traditional breeding practices. And then she declared, the processes of genetic engineering and traditional breeding are different, and according to the technical experts in the agency, they lead to different risks. Okay? That was her summary of the input. And 24 key documents from the FDA files that were pried out of the files through the lawsuit that I organized are posted on the website of the Alliance for Biointegrity, www.biointegrity.org. So you can read hers. I gave that the first position, memo number 1, because I think it's so important. She didn't say some of the experts think so, and she didn't say there's some disagreement. She said according to the technical experts in the agency, a very broad statement, because I was not able to find nor in the lawsuit did the FDA point to any memo from their scientists that actually supported the position the FDA actually eventually came out with, which is that these foods should be treated essentially the same as conventionally bred crops. That was the FDA. In public, when the FDA announced its policy statement on genetically engineered foods, after having received memo after memo from its own scientists explaining why there were differences, why there were unique risks, why there had to be safety testing, what did the FDA say in public? The agency, this is almost a direct quote. Oh, here we go. I can give you a direct quote. Nope, not there, but this is almost it. The agency is not aware of any information showing that foods derived from these new processes differ in any uniform or meaningful way from other food. Gee, doesn't that make you feel comfortable that the FDA's protecting our food, and they're going to say that after having received all the memos for more than a year from their own scientists? We're not aware of any information? Boy, I mean, their files had quite a lot of information, unless you discount the memos from your own scientists as information, and you only count as information the disinformation dispensed by Monsanto and other big biotech giants and the proponents. So that's the weird Orwellian world in which the FDA inhabits when it comes to biotechnology. So it's important to note that in allowing genetically engineered foods on the market, as the FDA did, not only did it lie, it broke the law. Because as I mentioned, our food safety laws are actually quite strong when it comes to new food additives, and those additive laws actually apply to genetically engineered foods. And the FDA has actually admitted that. They just claim that there's some exception for GMOs, which is not there. They tried to get around the law by claiming an exception that does not exist. Not the way even the root of the exception requires testing. Okay, there's no way, no legal way that genetically engineered foods could be allowed on the market in our country without each of them having been demonstrated safe through scientific procedures. That's the law, and those are the FDA's own regulations. The FDA has deliberately broken the law in order to enable genetically engineered foods to come to the market. And the FDA got the jump on every other nation in the regulating, and I think that's one reason they did. They made that pronouncement, and therefore that let other regulators have very lax regulation, but just require some superficial testing and saying, we're doing more than the FDA, and the FDA is well respected. So therefore you should be even more confident in what we're doing. And so the FDA set that up. If the FDA had actually told the truth in May of 1992 and said, look, we asked our scientists to do a review, they've told us we can't presume these foods are safe, that they do differ, that they entail a different set of risks than conventional foods. Every one of them is going to have to go through careful safety testing to demonstrate it's safe before it comes to market. That's what our food safety laws require anyway, and our scientists are telling us that's what science also requires. That would have ended the whole thing. I've talked to proponents who've agreed that would have ended the whole thing. That's why the FDA didn't tell the truth. That's why it didn't follow the law. Because if they had GMOs, it couldn't have survived. It was so delicate, so tenuous, there were so many public concerns as it was. So we wouldn't be here tonight discussing this. I would have spent the last 10 years of my life doing something other than researching and writing the book. So that's why these foods are on the market, because our Food and Drug Administration lied and broke the law, and broke faith with sound science as well. Okay, then I mentioned the first food that was produced by the technology that actually went through very rigorous independent review, because the tests on the flavor saver weren't all that rigorous, and they still raised a safety issue. This was an award-winning research design conducted. The lead researcher was one of the most eminent food safety researchers in the world. He had published hundreds of papers. He'd written 2 or 3 books on food safety. He was eminent, and the research design actually won out. There was a competition sponsored by the Scottish Ministry of Agriculture, and I think it was at least 30 proposals were submitted by scientists throughout Europe and maybe even beyond. And this research design won the prize, got the substantial government grant, and they did rigorous research on a genetically engineered potato, and the foreign gene that was put in expressed a protein that was known to be safe for mammals at even very high doses. And so there were deleterious, statistically significant deleterious results on the rats that consumed the genetically engineered crop. When he spoke out about it, he was slammed by the scientific community. The UK government stepped in. He was forced to be fired from the research institute because it was a government-funded research institute. His career was destroyed. His wife was fired too. They tried to prevent his research from being published, and yet it was of a high caliber, and The Lancet, which is one of the world's most prestigious medical journals, published it, and they even had triple the number of referees just because they knew how controversial it was. 6 referees, 5 out of the 6 voted for publication. The only one that didn't, I believe, had a conflict of interest anyway, but I say I believe because I better check on that. But I know there was, but in any event, 5 out of 6 is very strong. And yet, there have been such disinformation on that many people have been led to believe that was never published at all. And yet it was published in The Lancet. And in fact, the Royal Commission on Genetic Modification of New Zealand, in their report, they stated that because of the way he spoke about this, he basically prevented publication. So they didn't even know it was published. I mean, can you believe that? So, by now maybe you can. I mentioned other well-conducted studies. Let me just give you an example of one of the most troublesome, and that is that when several of the tests on genetically engineered foods that were already on the market, approved for marketing in the EU and certainly been marketed here in the US and Canada, when independent university researchers looked at the data again, and this was data that was submitted by the industry to the various regulators, they found that there were problems, and that data had been declared to be showing the foods were safe. And then when they did further study, but even with those, they analyzed, and some of the most problematic indications were for livers and kidneys. Well, they noted that that's really troublesome because livers and the kidneys are the main reactive organs in cases of chronic toxicity, which certainly raises a reasonable concern that there had been chronic toxicity involved. So, and when long-term studies have been done, and there have been very few of them, they tend to show significant problems. So, we're really faced with one of the biggest frauds that's ever been perpetrated in the history of science, because it's not just the FDA that's been involved. As my book demonstrates, the mainstream scientific establishment has played a very strong and a very non-illustrious role in the fact that we have GMOs pervading our market. It's not a pretty picture, it's not a pretty story, but it's a story that needed to be told. So in some ways we've only scratched the surface tonight, but I think we've scratched it deeply enough so that you get a flavor of what's actually been going on, how the subtitle of my book is not an exaggeration, which my book shows that how science has been subverted, subversion of science, corruption of government, systematic deception of the public. And that unfortunately has happened, and it's because of the subversion and the corruption and the deception that genetically engineered foods have been able to permeate our market. It's my deep hope, it was my hope in writing the book, that the truth will come out and that enough people in general and also enough key people, people of influence, will read the book, realize how they and so many millions of people have been hoodwinked, and do something about it. Because we do not have to give up hope. It would be very easy to turn things around and do what we really need to do, which is to ban these foods and stop all of this money from being directed to it and directed into safe, sustainable agricultural techniques, which have been proven to work in the third world and are also needed in the industrialized world. But we do not need genetically engineered foods. We need the truth about genetically engineered foods to be known, and we need to have our markets and our fields free of them. Thank you very much.
Okay, we're going to have a question and answer session now. I know this is a very complex topic, so we've tried to reserve enough time for lots of questions. And if we want to line up over there is the best way to do it. That way we can be most effective with everyone's time.
While people are lining up, I want to say something that I had meant to mention in the beginning, and that is to express my gratitude to Dr. David Schubert of the Salk Institute, who was kind enough to drive out here to introduce me. But he, as he said, he was on the review team, the scientist review team. And David, they were all very diligent, and David was extremely diligent. He would read each chapter fairly soon after I sent it to him. He would write very incisive comments, always trying to assure that every chapter was as accurate as we could make it. And he is a scientist who has maintained his integrity, and he has boldly spoken out. In fact, many of you have probably read op-eds of his that appeared in local newspapers, and he's been courageous. He's taken a lot of flack from his colleagues, probably both at the Institute and in general, and he has not been cowed, as so many scientists have been afraid to speak out. David has maintained his integrity and his courage, and we're very, very thankful that there are scientists like him who are going to bat for us and are trying to uphold the integrity of science. So again, David, thank you so much.
If you haven't bought your book yet, there are more copies available, so go to the back table and get your book so you can get it signed at the end. Thank you.
And some of you came up while the beginning ceremonies were starting wanting me to sign a book, and I said, let's wait. So those of you, there were about 3 or 4 of you, those of you should be first in line, so you don't, because you did have the book and you wanted me to sign it, and then those of you, the rest of you who would like a book signed, I'll be happy to stand and sign them for you.
Thank you very much for speaking to us tonight. Quick question. I grapple with the motivation. I grapple with, what's the incentive? How did it all get rolling? And you gave a couple examples of, well, it sounds kind of almost like it'd be too much of a hassle to stop it at this point. Is there some conspiracy? I'm waiting for what's the big evil animal behind the whole thing?
Well, it's interesting. Although the knee-jerk reaction among proponents of genetic engineering to my book is I'm spinning out some weird conspiracy theories, some weird. I don't think you will find the word conspiracy used once in my book. I don't try to develop a conspiracy theory. I don't need to. I'm laying out the facts, and I'm not trying to decide who colluded with whom and what the motive was. The main thing is the facts speak for themselves. There's been a lot of underhanded things going on by the FDA, by many eminent scientists and scientific organizations, and other people can try to connect the dots. My book is very long as it is, so I didn't need to do that. And I also didn't want to do that because people would say I was just involved in a conspiracy theory, but they say it anyway. But to tell you the truth, I'm not sure, and I don't care really.
fact is, it happened, and if you read my book, it shows you the whole history in a very comprehensive way of how genetic engineering began and how many scientists from the beginning started spin doctoring the truth, and then often even worse, to try to stave off regulation, to calm public fears. So, and you can see how as the years went on and the stakes got higher, the deception got deeper. And progressively, it's to the point, and again, there are examples in my book, where some scientists cannot differentiate their own hype from reality. And they talk to each other, and they start believing their own disinformation. And because they're saying it and they're scientists, they start believing it's true. You can see evidence of that in the book. It's really an amazing situation. So the main thing is to lay it out there and not, and I think it would probably be simple for some people to connect dots and establish conspiracies, and I'm going to leave that up to other people because I don't need to do it. Enough has been done, and the facts speak for themselves. Yes.
Thank you, sir, for sharing with us the antibiotic induction, as you did. I even have more constant concerns because more regularly we have to eat cereal grains. And I've been reading lately in different places about the genetic modification of grains like corn and soybeans and so forth, so that great amounts of pesticides and herbicides can be sprayed on such. And so my question is, are there any scientific studies to show the effects on human consumption of the grains that are so sprayed with these herbicides and pesticides to show the deleterious effects?
To my knowledge, there have not been clinical, and anybody can correct me if I'm wrong in this, there haven't been clinical human feeding studies yet with the herbicides that are being put on in much greater quantities than they ever could have been before on the crops that have been genetically engineered to resist them. And just as an important point of information, the majority of genetically engineered crops that are in our fields now and in our food have been engineered to resist herbicides, and especially glyphosate, which is probably the most widely applied herbicide in the world, and which a special panel of the World Health Organization quite recently concluded was a probable human carcinogen. And so you've got much more herbicide residue on those crops than was ever possible before, and in comparison to organic foods, then there's much greater herbicide. It's sprayed on the beans or on the corn and the other crops after they've sprouted, after they're up. So people are going to ingest those residues. And there have been one of the most rigorously conducted studies on GMOs separately tested the effects of glyphosate on the laboratory rats, in separate from the genetic engineering, and separated out then also genetic engineering from the glyphosate. GMO, glyphosate-resistant soy, for instance, but in this case I think it was corn, that hadn't been sprayed. And in both cases, there was statistically significant harm to the laboratory animals. So that study showed that the glyphosate on its own was harmful to those rats, and the genetic engineering on its own was doing something that was creating a problem, apparently creating a problem that was showing up as physiological harm. So that's very troubling, or it should be, because that means that with genetically engineered crops, there's kind of a double whammy. You've got the risks, the background risks of the genetic engineering process itself, and on top of that, you've got the risks of the herbicide residues that are in the crops. So it's not a good situation, because there is a substantial amount of evidence that is accumulating showing that glyphosate is quite harmful to many different living organisms. And again, as I said, the WHO has now come out with a statement it's a probable human carcinogen. So that's something not to be taken lightly. This is just a public service announcement too. Within recent years, a new use has been discovered for glyphosate as a crop desiccant. That means spraying it on crops, even those that are not engineered to resist it, to actually stop the growing process and to dry out the crop so it can be harvested more quickly. So many farmers are now spraying glyphosate on their wheat or their barley or their oats. There's a wide range of plants and vegetables on which glyphosate is now being sprayed before harvest as a desiccant to dry it out. And the EPA has basically allowed, you know, a significant increase in the residue without, on the basis of no real genuine rigorous testing. They just keep raising the level to suit the need of the biotech industry. But the problem there is that, again, right before harvest, these crops are being subjected to this herbicide. So that alone is good reason to try to look for organic, because that glyphosate can't be used as a desiccant in organic agriculture. So even if you're buying, you know, wheat, there's not genetically engineered wheat on the market yet, or at least not knowingly. But if you're buying non-organic wheat, then the odds are you're getting unhealthy dose or potentially unhealthy doses of glyphosate. So I just wanted to mention that. You might want to research that more, but it's one other good reason to be looking for organic food.
Well, thank you so much, even though this is nightmarish information. I know you do speak of the FDA, but are the people in the FDA political appointees? Is that how they got there? And that's just one part, but the other thing that I'm concerned...
Just repeat the last thing. Are there people within the FDA?
In the FDA, are they political appointees who are making these decisions?
I'll answer that.
Okay. And then
next question.
The next part is, if I know that I eat practically all organic food, but the aspect of the feed for animals, they're being fed corn products, which are probably genetically modified. So when we eat...
Most likely are in most cases.
Right. So we're still getting a dose of the genetically modified food when we ingest animal products that from animals who have not been fed organically. Is that correct?
Both very good questions. I'll answer the first one first. And hopefully my memory will be good enough to remember the second one by the time I answer the first. So, were there political appointees that were making some of the crucial decisions at the FDA? Apparently. Let me give you a key glaring example. Many of you are probably aware of this example, but it bears repeating. A man by the name of Michael Taylor, a lawyer, he began his career with the FDA, or at least he had a long career at the FDA as an FDA attorney, served in several key positions. At one point was, I think, a special counsel to the commission of the FDA. Then at one point, he did what so many government employees do. He went through the revolving door, and he went to work in the private sector, and he became a partner at a major Washington law firm that was representing Monsanto and the International Food Biotechnology Council. So he went from being an FDA attorney to being an attorney who was basically the outside counsel for Monsanto, helping Monsanto develop the policy it wanted on genetically engineered foods and the, how it wanted the FDA to deal with it. And I mean, really, what Monsanto, what you would want if you were a big biotech company, what you want is basically self-regulation, but with the illusion that the FDA is regulating you. That's great. The FDA is not imposing any burden on you, but it's allowing you to, in public, present yourself as being regulated and going through scientific reviews with your products with the FDA. That's really what the FDA, that's what Monsanto and the industry wanted. So at some point, when it was, from my review of the record, when it was becoming clear to the FDA administrators and other people up the chain that the FDA scientists were basically behaving as scientists. Lo and behold, they were taking their role seriously. They were writing memos, they were warning, they were protesting when drafts of the policy statement were coming back, ignoring their input. So a new position was created in the summer of 1991 at the FDA. Deputy Commissioner for Policy, that was a new position. Guess who got appointed to that new position? Yeah, Michael Taylor. So now he goes from the law firm back to the FDA, but now as Deputy Commissioner for Policy, and he was Deputy Commissioner for Policy while the policy on genetically engineered foods was being finalized over often the protests of the FDA scientists. Subsequently, after he was at the FDA, after he had given Monsanto everything Monsanto wanted, he went through the revolving door again, became hired directly by Monsanto. Now he's no longer just an outside counsel. He became a vice president for public policy in charge of Monsanto's Washington office. In other words, he became Monsanto's chief lobbyist in Washington. What happened a few years ago? Back through the revolving door again, hired, basically brought back to the FDA as what's called the food czar. He's now the Deputy Commissioner in charge of food safety, all of food safety, GMOs, the whole thing. Just the ideal man to be in that sensitive position, wouldn't you agree? Okay, so that's your government at work. That's the revolving door oiled very, very well. Okay, so that answers your question about that. And there are other politically influenced administrators. My book discusses more of how the political influence, how the Office of Management and Budget was able to intervene and overrule FDA scientists and change things in the FDA policy statement. Within 2 weeks of its release, the Office of Management and Budget, all the scientific experts and some lawyer in HEW higher up were able to make significant changes in the FDA's policy statement. They're supposed to be scientific. They didn't like it, and they were able to get changes in there like that. Okay, so second question was
on meat, that the corn fed to beef
in
right.
animal feed.
Yeah.
And it's interesting, one of the memos that I found that I thought is quite relevant to this, it's FDA memo number 10, posted on the Alliance for Biointegrity website. It was written by the director of the FDA Center for Veterinary Medicine, which is one of the biggest divisions within the FDA. They've got many veterinarians there and other experts in animal health and animal safety. And he wrote a strong memo saying that I and other scientists at the CVM think that genetically engineered food should be tested. We'd like to actually conduct our own tests on them, so I remember the memo. And he stated that the issue of feeding, he mentioned, look, for many years, the average human is only going to be consuming a fairly small percentage of GMOs compared to their whole diet. It's going to be a fairly small percentage, and he was right on that. There aren't that many whole GMOs that Americans have been eating. It's basically ingredients derived from, soy oil or corn starch. And he said, but the case is going to be very different with farm animals. A majority of the diet of farm animals is going to be GMOs from an early stage. And he was right on that. So he said that presents unique animal food safety concerns and unique safety concerns for the human consumer, because he stated there could be residues of unintended toxins or other harmful chemicals that are in the GMOs. Those harmful chemicals build up in the tissues or the meat or the eggs, the tissues or the milk or the eggs of the animals, and then the human consumers eat that, and that could become a human health problem. And he said, we think we need to really, there has to be serious study of all that. I'm paraphrasing now, but you can read the memo, FDA memo number 10, and that was ignored too, of course. But so again, the FDA experts were well aware of that potential. And yet again, that was just one of the many memos that was ignored, and then the FDA claimed they weren't aware of any information. So yes, two good questions and some unfortunate, some pretty ugly examples from the FDA.
Thank you, and I'm not going to be sleeping very well tonight.
Neither are we.
Okay, 5 more minutes.
So I'm Jose. Thank you for coming today and, educating us on, the facts that aren't being said. And one thing that, I noticed you said is that the truth speaks for itself. Well, in the political world that we navigate through, that is not necessarily the case. With climate denial being one of those where there's plenty of evidence, there's plenty of facts, but people still, 50% still believe that there's a question, right? So when you have, on this spectrum, where you have many scientists that say GMOs are okay, they're okay, they're okay, and I would say that liberals and progressives and Democrats are extremely smart. What do you say to these scientists like yourself and many others, and especially with the FDA scientists, to get more political with their language? Because yes, we understand it's deadly, it's horrible, it's nightmarish. But why aren't the scientists going out there screaming on the mountaintops, going on the political talks, going to talking to our politicians and actually making the case? Because if we just say, oh, look, the facts, and here's the data sheets, here's the memos, here's all this, and most people are like, and that's basically what I see.
All of your points are very important, and the truth has to get out there. There are some senators and there are key staff and senators on Capitol Hill who wanted my book. I had a lot of meetings on Capitol Hill in July and are interested in it. And by the way, this, although the other side tries to paint any concerns about GMOs as some radical left-wing thing, and they present people like me as the climate deniers of the left. My book, I've been reaching out to, there are plenty of Republicans who, when they learn the facts, are very concerned, libertarians. It should not ever be presented as a partisan political issue. This cuts across every political spectrum, it should. And my book demonstrates, actually in the last chapter, that the average conservative in America has far more ideological reason to oppose GMOs than the average progressive does. So, and I'm reaching out to Republicans as well. And people, always try to assume they know somebody's political affiliation if they're raising concerns about GMOs. That isn't the case, and it certainly shouldn't be the case. And it's increasingly not going to be the case. So, most scientists, though, who have concerns are afraid to voice them, especially if they don't have tenure at their universities. The book goes into this. There's a chilling effect that's permeating the scientific community. That's just one of the many instances in which science has been subverted. Science, the lifeblood of science, is the free and open flow of ideas and open debate. That has been shut down in the case of biotechnology. And it is interesting. Several of the scientists who are actually concerned about the disinformation on climate change, who've signed petitions, declarations that there's a scientific consensus that climate change is actually happening. Some of them are the ones that are actually then participating in the disinformation on GMOs. So what we do need to do is to wake up. I think one thing we need to do is get a lot of the biologists and other scientists who've been hoodwinked, who don't understand, if they understand the facts and the extent to which they've got to stand up and fight to take science back. So I'm working on that too. Awesome. We all have to get bolder, and not every scientist gets out there like Dave Schubert, who knows the truth, but more and more will, hopefully.
Great, thank you.
Thank you.
Hi, first, thank you so much for your devotion and courage to bring the subject out and write your book. So you're bringing the education out. Probably the most powerful thing we can do is vote with our dollar and not buy and not purchase genetically modified food. My question is this as far as we have come, or is there something more that we can do besides voting with our dollar and educating people?
Well, that's an important part of it, because every time we do make purchases at the store, we are voting. And the food industry, in fact, Derek and Nancy Derek and Nancy Cassidy, I think you were introduced at the beginning, but they are stalwarts in the anti-GMO movement, and they've been doing quite a bit in trying to get labeling. They own a big health food store in the San Diego area.
We run a co-op.
Oh, co-op. Okay. In any event, correct me if I'm wrong, Derek and Nancy, but The food industry is a very low profit margin industry. Therefore, it's highly elastic to demand. If consumers, if even a fairly small percentage of consumers stop buying a particular product, and this was the case with the tuna, you know, when enough consumers stopped buying tuna that was being done in an irresponsible way as far as dolphins, that made a difference. It shifted. So what, maybe even 5% shift, the industry is sensitive to that. They can't afford basically to lose 5% because the profit margin is low enough. So if enough people, and by the way, the non-GMO market is probably, my understanding, the fastest growing niche in the food industry. Organic had been for the last few years, but within organic, non-GMO is even hotter than organic. Isn't that the case? That's what I think I've heard. So that's one reason, of course, there's this push on Capitol Hill to ban private labeling non-GMO, because it is taking away business. People don't want to eat GMOs, and so there's a huge battle going on. But to the extent that you can, when you shop, if you actually go out of your way to buy non-GMO products, you are casting a very important vote. A message is being sent, so that is very important. But I would do everything else, tell your friends. You don't have to, by the way, I'd love it for people to read my book, but I'm not just here to sell books. My main goal is to get the knowledge out. So there's some very good free resources too. There's an excellent free resource called GMO Myths and Truths, co-authored by 2 molecular geneticists. It's available at earthopensource.org. It's fantastic. It was one of the resources I often relied upon in writing parts of my book. I've cited that several times in the book. I highly recommend it. If you read that alone, you don't need to read my book to get all the facts you would need. But my book will give you much more, of a story and the history, and goes into things that can't do. If you read them both together, you can beat anybody in a debate. But again, GMO Myths and Truths is terrific. Get educated. Get your friends concerned. Everybody has a sphere of influence. So just work within your own sphere of influence, and those ripples start becoming waves, and there is nothing so powerful as an idea whose time has come. And I think the idea that genetic engineering is not in line with sound science, that it is not on the market according to the law, and that actually people are being hoodwinked, that's an idea whose time has come. And just help get the message out. And many of you are very more savvy than I about the political process, so I would just say, do whatever you think.
I actually have a question, actually, for the two of you. Maybe more for David than for you. Is this information starting to get through to some of the scientists who've, been refusing to admit it? And is there anything we can do to help break through the scientists? That's my question.
Was that a question for David?
Well, I think David's in the scientific community, so if you want to take a shot.
Well, I think the only way you can deal with this is a mano a mano with these individuals, and there's a very complicated thing with the dynamic in the scientific community, and I don't think you can address it in a short period of time. So if somebody wants to talk to me about it, glad to talk.
Somebody was talking about the book when David was introduced, but I want to make sure people understand. David is a professor and a laboratory director at Salk, so he holds important positions there. And again, it's great to have somebody of his caliber having written a nice endorsement for my book, and he's one of my advisors.
Let's give another round of applause. Closing now, I just want to make one more comment. I did several months of work trying to investigate this, and it's a lot of work because there's so many paid shills out there that are obviously working for Monsanto or the industry, and you just get covered with a bunch of additional things, so it's really hard to get the information. So his book is vital for that. Again, I want to thank the club here for allowing this event to come here, and we really, really appreciate it. We want to do more things like this together. We have more books in the back. Please buy those. Please get on our list so if there's things happening with regard to genetic modification. One more thing. There's apps that you can run on your smartphone now, non-GMO products, so you can just scan the barcode, and for many products it'll tell you if it is non-GMO, and that's kind of helpful to vote with your pocketbook. Thank you very much.